peculiar to donkeys. And then we're going to have a little discussion later on this morning about the issues of donkeys being the victims of their own wonderful success, the feral and unwanted donkeys that we find in the United States. So that's going to be kind of interesting. But our first speaker this morning, Dr. Nicola Pusterla, is a faculty member here at the University of California, Davis in the veterinary school. He's a specialist in equine internal medicine with emphasis on infectious diseases. And among the really many infectious diseases he studies, one of these particularly versed in are the herpes viruses. And if you've paid any attention to what's been going on in the horse world in the last several years, we've had some significant outbreaks of neurologic form of equine herpes. And there may be some relationships between the equine herpes viruses and there's 6 asinine herpes viruses?
You can't give it away.
Okay, well, I bet I won't. I won't. And I'm just kind of used up old horseshoe, so I don't understand these things anyway. But Nicola does. He's a brilliant scientist, researcher, and clinician, and he's going to talk to you about a group of really important tiny organisms that infect our donkeys in relationship to other kinds of equids. So, Nicola?
Thanks, Eric. Good morning. It's a great pleasure to be here. When Eric asked me, it was almost a year ago, to talk about herpes viruses in donkeys, I was a little bit reluctant because if you look at the literature, I could be done in one slide. So I'm actually glad that we added the mules, but it wasn't enough. So we had to add the horses. I hope you'll forgive me to talk about horses and mules. I know that this is a crowd that mainly focuses on donkey, but you'll see that there's a good interrelationship between these 3 species where we truly recognize herpes viruses in horses. That's why most of them are called equine herpes viruses. There are, however, cross-species issues that we encounter where mules and donkey may actually play a tremendous role in maintaining these viruses, both asinine and equine herpes viruses, in different equid populations. So I'm going to brush up a little bit on what herpes viruses are and how they differentiate. And there's a lot of numbers and numbering system. Just remember that when I'm talking about equine herpes viruses, I'm talking about herpes viruses that do primarily affect horses. Any of you have horses at home? I know this is not the time to raise your hand. You may be in the wrong symposium. But I'm assuming some of you, one at least, yeah, there you go. Thanks for being honest. When we're talking about herpes viruses in donkeys, we're talking about asinine herpes viruses. And the mules, they're taking the donkey trend. Mules and donkeys are put in the same groups. And we know that are primarily and preferentially infected at carrying asinine herpes viruses. I'll talk about the clinical entities. Some of you may have encountered some of these diseases. They're sporadic diseases. I also would like to hear from you. Not right now. We'll keep questions to the end. I was told that. But there's a lot of information that I'm missing when it comes to, any of you don't answer the question, but it's just a hypothetical question. Abortions in donkeys, are they related to herpes viruses? Do we see neurological disease associated with herpes viruses in donkeys and mules? I'm going to try to answer some of these. Unfortunately, there is not enough material out there, not enough outbreaks that help us answer these kind of questions. I'll be talking about a little bit of diagnostic to show that there is actually support to investigate this disease, and last but not least, treatment and prevention. Now, when it comes to herpes viruses, there are approximately 11 herpes viruses that infect equids, 5 that specifically infect horses. They make it easy, 1 through 5. So bear with me, it's not high math, it's Sunday morning. 5 that infect donkeys and mules, called asinine. Unfortunately, the numbering is not so that the HV1 in horses is parallel to the asinine herpes virus 1. There's a little bit of a mix-up in numbers there. The herpes viruses are grouped into two different subgroups, the alpha and the gamma herpes viruses. What differentiates the two is mainly that the alpha herpes viruses are the one that are associated with clinical disease. We're talking herpes virus 1, herpes virus 4, asinine herpes virus 3, as well as equine herpes virus 9. Equine herpes virus 9 is a herpes virus that affect wild equids, zebras, and some of the wild asses. The alpha subfamily is also characterized by a very short reproductive life cycle, and, as we always say, herpes virus is for life. That's also true for human beings.
They can't hear on the webinar, and we believe it's because we need to drag your presentation to the computer.
Okay.
Play it off the computer. I'm really sorry to interrupt, but
No, that's okay. Okay.
webinar folks out there, so
Free lunch for everybody
yeah, okay.
with drinks. That's what Eric just told me.
Yeah.
So, anyways, we can still chat. I'm not going to take questions because I know that I won't be passing slide number 2. When it comes to, can I still keep on talking? Okay, thank you. That would be kind of odd being up here. How are you guys doing? The gamma herpes viruses on the other side are the one that we know they're around, but they're generally not associated with clinical disease. And it's kind of mind-blowing to consider that you can find viruses in a large number of donkeys and horses and not having to be worried about it. There's always a reason why a virus is in a host. What you recognize is that herpes viruses do actually cause a variety of syndrome. They can affect the respiratory tract. That's generally the most common presentation. They can also, as you can see from the slide, getting on that one, affect the central nervous system and the reproductive tract. I'm still going to need my slide at some point. Deep surgery. That's something I did.
No.
I was worried there for a sec. Am I good?
Yeah, you
Thank you. That's nice of you. I'm going to sit in the audience. This is just a little table just showing some of the interactions. And I'm still talking about herpes viruses. But you look at the equine right in the middle, donkeys to your right, and the parallel. EHV1, EHV4 causes upper airway disease, running pneumonitis. The parallel in the donkey world would be the asinine herpes virus 3. Now, the interesting part from an evolutionary standpoint, it seems that EHV1 has actually originated from the asinine herpes virus 3. So horses can claim it and blame donkeys for that virus. With EHV1, because the virus has an affinity to the bloodstream, we also recognize other less common syndrome, abortion, and neurological disease. I have yet still to wait for a donkey for which I have a diagnosis, or either abortion or neurological disease. There are venereal diseases, EHV3 and asinine herpes virus 3. That's the only one where the numbers actually truly match. Causes a venereal disease associated with pustule crust in the urogenital apparatus, face occasionally. Some of the gamma herpes viruses has been associated with some progressive interstitial pneumonia. You may or may not have heard about multinodular pulmonary fibrosis. And last but not least, the gamma herpes viruses, EHV2 and asinine herpes virus 2 are associated in young horses occasionally with mild respiratory disease. Just to give you kind of an overview where numbers are in relationship to the equine or the asinine. Now, one of the characteristics of herpes viruses is latency. And latency means nothing else that after a primary infection or a follow-up infection, the virus has a possibility to actually become dormant and escape the immune system. The preferential site where these viruses like to go dormant. It's generally lymphatic tissue or specific neurological tissue. What happens with latency, that's an evolutionary way to be retained in a horse population, happens at an early stage in life and persists for the entire life of that host. Now, what we don't know is, does every primary infection lead to latency? We don't know. It's possible that some, depending on the virus and the host, may actually lead to that dormant stage. Now, the danger of the dormant stage, it's like a ticking bomb. It's there. The virus will take advantage of a host that is stressed, immunocompromised. That's why we see these great outbreaks during stressful events, horse event, transportation, show, when the host is immunocompromised. The virus reactivates, goes back to site where it replicates, and is shed, potentially infects susceptible animals. If you look at the overall prevalence of latency, which is how many horses, I have to talk EHV1, where most of the information is available. We look at what is the percentage of horses that are latent infected. And so the real answer to that is somewhere between 0 and 100%. You're always good with that one. You go 50%, it's right in the middle. It's kind of lukewarm. The problem is we do not know. There's not a single magic number that fits all horse population. Each horse population is slightly variable. There's a little bit of information out there using some of the sophisticated molecular tool. Study from France found 62% of horses latently infected with evidence of dormant virus in bronchial lymph node or trigeminal ganglia. That's some of the sites where the virus likes to remain dormant. Study from central Kentucky looking at brood mares, 54%, because we like to be slightly different on the West Coast. We did a similar study and got up to 15%. And that's looking at horses undergoing routine necropsy for a reason other than respiratory or neurological disease. If you look, however, within the equids that we looked at, and we had 153 of them, 30% of thoroughbreds had evidence of latent infection. 50% of mules had evidence of latent infection. Stay in your chair. 100% of donkeys had evidence of EHV1, the presence of latent virus, EHV1. The number of donkeys and mules was small, that said. That means to answer that question, you can say there is not 1% that fits all. It depends. It depends on the geographic area. It depends on the husbandry. Why is it that thoroughbreds have a higher percentage than other breeds? Probably the husbandry. Breeding farm, lots of horses, lots of interaction, young horses with adult horses, compared to the backyard breeder that may have 1 or 2 foals. Not quite sure about the mules and the donkey. It also is variable with the age. The older the horse is, the more likely you'll be able to find EHV1 in a latent and dormant stage. So talking about the diseases, the most prevalent disease of herpes viruses in any equids will be rhinopneumonitis. Rhino means inflammation of the upper airway, and pneumonitis, occasionally some of these horses will develop lower airway disease, meaning pneumonia on occasion. It generally affects young horses. That's the snotty nose, the kid going to daycare. That's very similar. I mean, a foal without a snotty nose is a foal that is missing on something. And we'll see that associated with EHV1, EHV4, but also asinine herpes virus 3. As I mentioned before, it affects all ages. Generally in older horses, the clinical signs are milder. The clinical signs will be characterized by what we consider or call a mild to moderate upper respiratory catarrh, nasal discharge, fever, depression, anorexia. The nasal discharge starts initially serous, ends being mucopurulent, as you can see from this picture, a little bit of swelling of the lymph node in that intermandibular space, and generally there is no coughing. If there is coughing, we're looking at other type viruses. We're looking at equine influenza virus or even some of the equine rhinitis viruses. What we know is that this virus can also denudate and weaken the lower airways, predisposing these animals to then develop secondary bacterial infection. If you ever experience an outbreak of rhinopneumonitis, and a foal has persistent fever, coughing, and abnormal lung sound and auscultation, you want to think that this foal may have developed a secondary bacterial infection. As I mentioned before, EHV1, very specific to EHV1. We don't know about asinine herpes virus 3, which is the parallel. in the donkey world, and definitely not for EHV4. This virus will also affect lymphocytes. Lymphocytes are a very specific subset of the white blood cells. That means that once the virus is in lymphocyte, it can travel anywhere within the body. That's why with the EHV1, we actually see two complications. They're rare complications. That said, they're devastating complications. One of them being abortion, the other one being the neurological form. The abortion generally associated with late-term abortion or the birth of weak foal that generally succumb from cardiovascular compromise within 1 to 2 days. We recognize either sporadic abortion. A sporadic abortion goes back to a dam during the pregnancy that has a reactivation of that latent stage. The virus then crosses the duroplacental unit and affects the fetus. That's one possibility. The other possibility is that a herd of susceptible pregnant mares becomes exposed to EHV1 from asymptomatic or asymptomatic shitter, which then leads to the infection, viremia, meaning virus in the bloodstream. The virus in this animal then enters that reproductive tract, leading either to placentitis or affects the fetus, and the end term being abortion. We don't know when it comes to EHV3. Do we recognize abortion? Do we recognize herpes virus as an issue in the donkey breeding industry? I don't have the answer. I would say based on what we see here in Davis and based on the literature, there's not enough evidence that support that asinine herpes virus 3 or even equine herpes virus 1 can actually lead to abortion in donkeys. The neurological disease is another one of these diseases that we only recognize in horses. I haven't been able so far to recognize a donkey or a mule that presented with neurological disease. It generally follows a mild respiratory disease with fever. These horses, that virus has a great affinity to the spinal cord. That's why the clinical signs are generally associated with spinal cord sign, incoordination, weakness, recumbency, reduction in sensation in the anal perianal area, inability to urinate, defecate, occasionally cranial nerve deficit, facial nerve, tongue paralysis, and vestibular signs, nystagmus, head-tailed, and ataxia. Very devastating condition for those who have ever been involved with any outbreak or any case of EHM. Some of you may remember that in May 2011, there was probably the largest multi-state outbreak of equine herpes virus 1 myeloencephalopathy, or EHM, that ever occurred in U.S. history following the Western National Championship that were held in Ogden, Utah. 421 horses kept in a small environment, poor husbandry, poor biosecurity, a lot of stress. I always say, these are man-made outbreaks. Outbreaks because it's kind of the perfect storm. Many factors are involved there. Several horses came back from that outbreak in several of the western states, developed neurological disease, were eventually humanely destroyed, and a diagnosis was set. A subset of these horses came back to California. It's a short circuit and ended down in the Central Valley. One horse went down the fairground, was euthanized, was necropsy at the state lab down in San Bernardino, and was found positive for EHV1. So we knew at that stage, end of May, that we're dealing with a major outbreak of EHM. If you look at the overall statistic, and USDA and APHIS has done a phenomenal job at collating all that information. They wanted that every single horse with neurological signs or EHV1 infection will be a horse with fever, respiratory signs, but no neurological sign will be reported to track these animals. But a total of 90 horses. Most of these horses were horses that attended the show. A small subset were horses that remained at home. These horses, however, got exposed to horses that returned from the show. I said initially there were 421 horses. These 421 horses could have exposed 3,600 horses totally. We only ended with 36 secondary infections. So kudos to the horse industry pulling it together and instituting good and proper biosecurity protocol. This table down here shows the cases by state, and they're divided, as I mentioned before. EHV1 case will be horses with fever, respiratory sign, and EHM cases will be horses with neurological disease. You can see California here was leading the pack, as always. We want to be a little bit bigger and a little bit better. 22 cases, 14 EHV1, 8 cases of EHM. If you look at the outcome, 13, is that time for me to stop? Yeah, I was worried there for a sec. 13 horses had to be humanely destroyed. That's 13 out of 90 horses with clinical signs. That's 14%. If you put it in the context of neurological disease, 13 out of 39, I don't have a 13 out of 33. That's close to 40%, almost 1 out of 2 horses that eventually ended developing neurological signs did not survive. We got 5 of these 8 horses. We always believe we get these cases because we're a premium facility that offer state-of-the-art care, and the reality is that these cases are not good for business. Everybody wants to get them out of the practice area. But they're great ways to actually support these cases, and the outcome was actually very successful. We got 5 cases over a 2-week period. These were all young horses. Remember, these are horses that these are competing, cutting horses. 3 geldings, 2 mares. They all presented with similar clinical signs in coordination, affecting mainly the hind legs, urinary incontinence being the most common clinical signs. We treated these horses in a similar fashion, and I'll postpone treatment to later on, so we'll be talking a little bit and expand on that. We treated these horses similarly. We put horses that are unable to stand or unable to fully bear weight. We put them in sling, and we support them that way. It's important for horses to actually be kept standing. Horses do poorly. That's the same for any equine. Once they are recumbent, there's a lot of complication, decubital lesion, aspiration pneumonia, myopathy, just to name a few. 4 to 5 horses got out the door. Average time, hospitalization time, 20 days. Average tag for these horses, $7,000. Each horse spent in the hospital what they earned in Ogden. So it was kind of a trade-off. There's one single little filly that didn't make it. That filly never went to Ogden. She stayed at home. She got exposed to a horse that was shedding HV1. That filly came in. She was mildly neurologic. We weren't too worried about her. Within 24 hours, that mare was down and dying and had to be euthanized. She developed a very severe complication where she developed very severe central signs. If you look at the overall amount of virus that is shed, and that's a passion of mine, I like to do molecular epidemiology, and I like to put numbers to diseases. And we know that in general, numbers, and that's true for viruses, can be a prognosticator for outcome, with high number being poor outcome. The table, the upper table on the left shows the EHV1 viral load in nasal secretion. Don't focus on the number, just looking at the graph. For the people on the webinar, they probably won't see it. If you look at the horses that survived, these would be the black symbols. They all became PCR negative in nasal secretion by day 5. If you look at the blood, that would be the lower graph, they all became negative by day 6. If you look at that filly that did not survive, there's a tremendous difference in viral load in nasal secretion, that's on the top, and in blood, that's on the bottom. And we've played that game with now quite a few of these horses, and that's shown here. There's generally a 10-fold difference in viral load in blood, and up to 1,000-fold difference in viral load in nasal secretion between survivor and non-survivor. And we're looking at horses that don't survive, horses that euthanize for medical reason and not for financial reason. Because we have extra time at the university, we like to play little games. Just to illustrate the typhoid Mary potential of a horse with neurological disease. And these horses are shedding excuse my poor English, a bunch load of virus. This is a horse here that is shedding several million viral copies. That does not necessarily represent viruses. What we did is we swapped the environment, the wall, the sling, the back of the horse, and you see that each of these swabs came back PCR positive. This beautiful woman here is Dr. Chris Testel. She's not in the audience, and if I say something inappropriate, I was never here today. It's going to be hard to justify with the mic and the accent. Oh, darn, I'm in trouble. Anyway, she spent 20 minutes caring for that horse, and we asked her kindly if we could swab areas. So we swabbed gloves, we swabbed the coat, the face, and the nares. And we recognized that each of these areas contained EHV1. And you can imagine if Dr. Estelle would walk out of that unit, maybe not wearing gloves to start with, and go touch other horses, or wear gloves and then realize that she wants to pick her nose and then go touch a horse. You can imagine that from a biosecurity standpoint could be detrimental. So what you learn from here is do not pick your nose. No, wear gloves and use common sense biosecurity protocol. Now, I had to blame somebody. So I say, let's start by blaming the donkeys. That's a good way to place, and good place, and probably a good way to become popular here. There has been in the past the kind of perception that mules and donkey may actually play a role in outbreaks of herpes virus 1 myeloencephalopathy. There wasn't a lot of good evidence. We know that mules and donkey can seroconvert, meaning they can develop antibodies following a EHV1 outbreak. There is a very interesting piece of paper that unfortunately was never published by Dr. Hughes and Dr. Carson here at Davis. In the mid-80s, they recognized several outbreaks in the western states associated with EHV1. So outbreak of equine herpes virus 1 myeloencephalopathy in horses. And there was a connection with mules and donkeys. A total of 40 horses out of 12 premise developed EHM. Out of these 12 premise, there were a total of 17 mules and 4 donkeys. None of these mules/donkey developed neurological signs. Some of them developed clinical disease in the form of fever and lethargy. What was found from an epidemiological standpoint is that in each of these outbreaks, there was a common source. And these were mules and donkeys that attended the Bishop Mule Day. So there too, the relationship between mules and donkeys, and for those who have never gone to the Bishop Mule Day, as the name says, there's a lot of mules. There are also donkeys and horses. There's one report from North India showing on one mule with neurological disease, they were able to actually isolate an EHV1-like organism out of the central nervous tissue. However, that organism was never genetically characterized. It was only physicochemically characterized. And as I mentioned initially, we found 100% of donkeys, small number well understood, carrying EHV1 in a latent form in the trigeminal ganglia. Now, we were fortunate to some extent to be involved with an outbreak where in donkeys, these were mules and horses of EHM at a packing station in the eastern Sierras. It started with a standardbred that was brought to the hospital with neurological deficit. We diagnosed her with EHM. And we thought, oh, she's from a packing station, meaning that there are mules, maybe donkeys, they were on that day, and horses. We thought, well, that's a great way to potentially looking at the interaction between different equids. So what we did is we packed the minivan, found a few volunteers who would be crazy enough to swab mules. For those who ever tried to swab mules, it's always fun. And we went up the mountain with the idea to enroll as many horses. The enrollment criteria was you can put a halter on, yep, you're part of the study. So that wasn't really fancy, but we enrolled 75% of the horses and mules out there, did a physical exam, collected blood and nasal secretion. What we found is that there were a total of 8 horses during that outbreak that developed neurological disease. I'm just talking horses. It wasn't a single mule that showed at any given time any abnormal clinical signs. No fever, no nasal discharge, no neurological deficit. When we looked at the testing for EHV1, it was a similar percentage of mule and donkey that tested positive for EHV1. Kind of surprising. When we break it down to the amount of virus shed, you're now familiar with this kind of graph. Amount of virus in viral load to your left, in nasal secretion to your right. The green one represents horses with neurological disease. If you look at if you look at blood, the green one up here, got to think about the people on the webinar, sorry. If you look at this group up here, these represent horses with neurological disease. They have the highest viral load in blood, followed by asymptomatic mules, yellow. These would be animal with no clinical signs. No, none of the mule had clinical signs. And asymptomatic horses in red. Horses with evidence of infection but no clinical signs. And this is statistically different amongst all the three groups. If you look at nasal secretion, look at between horses with herpes virus, EHM, and asymptomatic mule, no statistical difference, meaning the same amount of virus shed in nasal secretion, which is very high in these horses. And in red, we have asymptomatic horses, and there was a difference in nasal secretion between asymptomatic mules and asymptomatic horses. So what do we know? What do we learn from this is that mules are as susceptible to infection as horses. But for a reason that we still don't know, they don't seem to develop the more severe complication. Is it the lack of interaction or capability of the virus to go from the lymphocyte to endothelial cells, or cells that line the vascular system within the central nervous system? We know that mules, similar to donkey, are silent shedders when it comes to EHV1. And I don't want to discriminate against mules and donkey. I just want to say when we're looking at events, horse event, I'm not talking about resident equids. It's different when you have mules, donkey, and horses living in harmony in one place. I'm looking at events like the Bishop Mule Day. When mules, donkeys, and horses are brought stress and commingled, maybe we need to rethink the way we want to house these horses, as we should rethink the way we house any equids during event. And it comes down to basic biosecurity. I'm not going to ask if you have any questions because that will be probably the end of the seminar here. The equine gamma herpes viruses, these are very interesting organisms, very well adapted. You'll find them in 40–60% of every healthy horse in nasal secretion or in blood. They are widespread. Every horse population across the entire globe will be infected with some of the gamma herpes viruses. We know that experimentally, but also naturally, young horses can develop mild clinical signs. It's generally associated with rhinitis, pharyngitis, occasionally ocular lesion, because you can see from this picture, keratitis, keratoconjunctivitis. We don't know what these viruses or how these viruses affect and how they induce clinical disease. We believe, and that's work that was done by Dr. Bell, Dr. Stephanie Bell, as part of her PhD, there are certain strains that appear to be more virulent. There's a lot of variability, genetic variability, amongst the gamma herpes viruses. One of the theories is that certain strains are more virulent than others. One of the key characteristics of gamma herpes viruses is that they can immune modulate the immune system. That means they can downregulate the immune system. They produce a lot of solutes, cytokine, chemokine, interleukin, that weaken the host immune response and predispose these animals to potential co- or secondary infection. And that's probably the way this works, although still needs to be investigated. We looked a little bit into co-infection with gamma herpes viruses. We do a lot of biosurveillance for respiratory pathogens. We end with a lot of biological sample. And these are various group of horses with well-established natural infection, EHV1, EHV4, equine influenza virus, strep equi subspecies equi, causing strangles. We have a group of horses with infectious upper respiratory tract disease without any of these common respiratory pathogen and healthy control. And if you look at the overall percentage, if you look at healthy horses, we get like 20% of horses have EHV2 nasal secretion, 41% for EHV5, but there are nice and statistical difference. If you look at EHV4, 77% versus 18% in healthy. If you look at EHV5, 90% for horses with concurrent EHV4 infection versus 41%. Almost, it is twice as much. This makes you think that these viruses may actually predispose these horses to actually develop clinical disease if they get exposed to any of these other respiratory pathogens. But still needs to be proven. Right now, it's just a nice theory. What about asinine gamma herpes viruses? Well, this would have been the slide if I had to talk today on donkey herpes viruses only. There's barely anything out there. The only work that I could find was from Dr. Bell, who was a postgraduate student here at UC Davis, and we did some work together. She actually characterized an asinine herpes virus 2 out of a healthy mule. She did some very nice culture. Found also, because of the lack of sequence or genetic information in the data set, that the other gamma herpes viruses that have been implicated, asinine herpes virus 4 and 5, may actually be strains of asinine herpes virus 2. In other words, we truly don't know what's going on in the asinine world. If you look at the overall detection rate of asinine herpes virus 2 in mules and donkeys, we collected sample from Bishop Mule. They ended around 8%, slightly lower than what we know for horses. Horses will be in around, healthy horses, 20%. Looks like mules and donkey around 8%, at least for that population. The other part that we don't know is what do these viruses have? How do they interact and impact the host in regard to the immune system? Are they responsible to immunocompromising these hosts and potentially leading to other type of infection? When I move a little bit to multinodular pulmonary fibrosis, a condition that has recently been described associated with equine herpes virus 5, asinine herpes virus 4, and asinine herpes virus 5 affects horses as well as donkeys, generally middle-aged horses. And depending on the severity of the clinical presentation, you may see horses in the early stage that are exercise intolerant. They just not perform to the level they were intended to. As the disease progresses, these horses develop severe scarring of the lung. It is mainly affected with severe respiratory signs, increase of respiratory rate, increased respiratory effort, reduction in performance, occasionally fever due to secondary bacterial infection, coughing, nasal discharge. And they have generally blood work that is compatible with an inflammatory disease process. I wanted to share this video on this little Arabian mare that presented a few years ago. Unfortunately, this mare didn't make it. And you can see this animal in respiratory distress. That's the way these horses look in the end stage. Increased respiratory rate, increased respiratory effort. You can see the nostril flare. This mare is focused on one single thing: get enough oxygen in. There are very specific markers that help us diagnose this condition: radiographic changes, sonographic changes. The diagnosis is based on a biopsy of the lung tissue, very characteristic changes, histological changes associated with fibrosis and inflammatory cells. PCR is also being used, PCR in the detection of EHV5 in what we call pulmonary lavage fluid from the lower airway can really support the diagnosis. The treatment at this stage, because of the poor outcome, is mainly palliative. We have probably a 35% recovery rate, which is very low. The further advanced the horse is, the poorer the outcome. And the treatment generally is directed towards reducing inflammation and preventing further scarring of the lungs. As you can imagine, this is a very devastating disease. And expand on diagnostic. We will truly rely on diagnostics, and we have to have ways to determine the presence of these viruses in nasal secretion and blood. The way this is done these days, because of the quick turnaround time, the high sensitivity and specificity, is using molecular tools, PCR. I don't know if you guys are familiar with polymerase chain reaction. It's a molecular way to detect these viruses in a very effective and rapid way. The results are generally qualitative, means that a positive blood sample means the horse is viremic. The positive sample, a nasal secretion sample, means that the horse is shedding. Unfortunately, the qualitative result, the positive and negative, do not help determine the disease stage and infectious nature of these horses. We've found surrogate ways molecularly to address this and getting a better idea of what's going on with every single individual infected animal. When it comes to the gamma herpes virus, as I mentioned before, what does it mean if you find HV2 or HV5 or asinine herpes virus 2 in a clinically affected animal? I don't know, because you can swab the herd mate, healthy herd mate, and that animal may test positive as well. That's why most of the laboratory will not test for them, and I would not advise any laboratory to test for them, because you're opening a can of worms. You don't have the answer to why the animal now tests positive and what a positive result means. We've looked at PCR signature for various stages of EHV1, and this can also be used for other herpes virus diseases. If you look at the amount of virus that is present in blood and nasal secretion in different disease stages, horses with neurological disease, horses with fever or respiratory sign, as well as asymptomatic horses, horses being infected but not developing clinical sign. You can see that approximately 75% of horses with neurological signs will be here. I have to move the arrow, it goes dormant, it goes latent. It was a joke. 75% of these will test positive with a low viral load in blood, but they are hot in nasal secretion. You can imagine why these horses represent such a threat. If one of these horses, recombinant horses, shedding a lot of virus, enter the hospital, you can imagine that this virus will spread fairly quickly. We look at horses with fevers, they are positive, moderate load in blood, which explains why they're febrile. The load in nasal secretion is moderate as well. Horses that I consider asymptomatic, then mainly they're shedding virus in nasal secretion. And these are the horses that I'm worried about. These are the horses I'm worried about. I'm not worried about the horse with neurological disease or respiratory signs. I'll recognize that horse, I hope. I'll have one of my residents hopefully recognize that horse as being sick and take the right precaution. I'm worried about the horse that looks healthy, acts healthy, but is truly shedding virus. These are, to me, the horses that are difficult to appreciate. Hence, you need to treat every single horse in the same fashion, definitely during an outbreak. The treatment, just going to skip over treatment. The majority of these horses with EHV infection or mules and donkey with asinine herpes virus infection will have a self-limiting disease. You'll support them, good nutrition, good support, anti-inflammatory, help overcome that febrile depression period, and they bounce around. When it comes to diseases that are more advanced, where the outcome is poor, we're looking at abortion, neurological disease, multinodular pulmonary fibrosis, we need to use more potent drugs. We're focusing mainly on inflammation, antithrombotic drugs, anti-herpes or herpes virus drug, and some of the antimicrobial in case there is a secondary bacterial infection. I'm going to finish here with prevention. Are we doing good on time here? So prevention is, it's interesting. Everybody agonizes over the prevention. Every time we have an outbreak, we have to reinvent the wheel of biosecurity. Prevention is generally based on good biosecurity, monitoring the animal, and potentially using vaccination, a very potent way to minimize disease. Biosecurity is based on many principles, and you can make it very cumbersome. You can apply just to a few basic principles, with generally good hygiene, no cross-traffic. All of you have been part of labs, am I right? How many of you did wash hands between animals? I'm not going to ask the same question when you go to the bathroom. I'm very worried here. Very basic principle. And these principles should be part of the daily way you interact with the animals, and not just during periods or critical periods of outbreak. That's common sense practice to minimize disease spread. The daily monitor, how many of you own a thermometer? Be honest. There's potential here. Recognizing clinical signs. And recognizing that, oh, this horse today is febrile and has a snotty nose. I should be doing something. Isolating the horse, calling your vet. Monitoring horses on a daily basis. Even better, monitoring your horse when you go to a horse event and not waiting for them to get sick. And the vaccination. Vaccination is not a poor man's way to do biosecurity. It's not because you vaccinate your horse that you don't have to wash your hands. That's on top. Now, what we know with herpes viruses is there are vaccines out there as an aid in disease prevention, mainly when it comes to respiratory disease and abortion. That's true for horses, where we know that vaccinated horses are less likely to develop clinical signs. If they get infected, they'll shed less virus, which is good because there's less environmental contamination. And we also know that there is a lower level of viremia, virus in blood. And we know that the virus in blood is what gets some of these horses in trouble to then developing either abortion if it's a pregnant animal or neurological disease. Now the part that we don't know is how do these vaccines potentially cross-protect donkeys? How is an EH3-1, EH3-4 vaccine going to protect a donkey or mule for the respiratory rhinopneumonitis associated with asinine herpes virus 3? I don't have the answer. Nobody has ever done the studies. I'm going to finish with a few take-home messages. I hope I've shown you that herpes viruses are great viruses. We see clinical entity with the alpha herpes viruses. We're still struggling trying to understand what the gamma herpes viruses mean. The interaction of Mules donkey as potential silent shedder has, in my opinion, implication in the way we want to handle these different equids. Generally, treatment, not much to do other than supporting your horses. And last but not least, apply with basic biosecurity protocol, potential vaccination in order to minimize disease spread between horses or between donkeys and mules. And with this, I'm at the end. I'll be glad to entertain any questions. From a hypothetical standpoint, you'll definitely protect your horses. There are experimental models where horses are vaccinated and get infected. And we know that any of these vaccine modified or killed will reduce the attack rate, the severity of clinical signs, the amount of virus shed. They will not prevent infection. They will prevent disease, development of disease. Now, we don't know about non-horses, about other equids, if that's true as well. I wish I had the answer there. Somebody needs to do the study.
It couldn't hurt.
We don't have enough information. I would say the majority of donkey owners will actually vaccinate their animals for the prevention of EHV1 and EHV4 infection and some of the sequelae, mainly potential abortion. We haven't seen a lot of side effect associated with the vaccine. We don't have enough information to say that it's contraindicated. It's, I would say, good practice to, at least from a academic standpoint, looking at these viruses as being close related and assuming that an EHV1 specific vaccine would protect donkeys and mules against an asinine herpes virus 3 infection. The question is, how would you fulfill that hypothesis and developing a potential study design? There's different ways. You can do this experimentally. Take a certain group of mules or donkey, hopefully naive, meaning they've never been exposed to herpes viruses, which is kind of an oxymoron. That probably wouldn't happen, but at least no evidence of ongoing infection. And then challenging them, vaccinating some of these and not vaccinating others, and going back and challenging them and looking at surrogate of protection, which is clinical signs, scoring, viral shedding, recovery, weight loss, and so on. That's one way to do that, but that's experimental. Nature is slightly different. And another way is, and I'm assuming some of you are part of larger sanctuaries or larger herds. Yeah? Yeah, oh yeah, there we go. I'm talking to the right people. Is if you don't vaccinate, wait for an outbreak, and then get in and trying to vaccinate half the animal and the other half you don't vaccinate. And sometimes it's hard during the phase of an outbreak. These outbreaks are very dynamic and explosive. So even if you start vaccinating, we may still not be able to fully protect. The other way is you wait for natural infection, which is truly, we learn more from natural infection than we do from experimental study. That's the reality. If you have a herd and you decide to not vaccinate half of them and vaccinate the other half, and then you wait for an outbreak to happen. Remember, most of these outbreaks cause mild clinical disease. If you're looking at asinine herpes virus 3, rhinopneumonitis, these are mild. And you may see that every year. Young animal develop that little fever, slightly off, they have a snotty nose, and they just turn around in a day or two. That would be one way to actually look at the efficacy of these vaccines. If you vaccinate half of you yearlings or weanlings and the other half you don't, and you wait for natural infection to come in, and then you look at the surrogate. But that means that you need to diagnose the disease in the presence of these viruses. There was a question in the back?
Yeah, when you differentiate between the asinine and the equine version of the virus, how is it serologically serological? Is it antigenic? How are you differentiating? Just because you find it in an asinine species, you're calling it PhD, or is there a fundamental difference between the viral identity between the two?
The serology does not differentiate. They are homologous, and most of the serological tests are based on herpes virus or equine herpes virus. Equine herpes virus 1 is the basis. Hence, a positive response in a donkey, you wouldn't be able to differentiate. Genetically, yes, genetically they're different. They're different genetic profile. An asinine herpes virus 3, although closely related to equine herpes virus 1, is genetically different. There are areas within the genome that allows us to say, this is a red car versus this is a blue car. The car is just a way to illustrate.
Thank you. I'm wondering if someone from the Donkey Sanctuary could talk about what they might be dealing with herpes viruses there and their thoughts about vaccination.
Okay, so we've got about, as I said, we've got probably about 2,500 animals, and obviously new arrivals coming in as well, and we do have about 200 mules. We do definitely see respiratory disease associated with herpes viruses. The problem we've got is that we don't have good diagnostic tools in the UK for PCRs for asinine herpes, so the only PCRs we've got are actually for the EHV strains, and we do get positives for EHV 1, 4, 2 and 5. So we certainly see disease. We don't vaccinate for probably, there are pros and cons, I think, from the point of view of decision making on that. We don't, from the point of view of the short duration of immunity we would get, therefore, the slightly logistics of vaccinating all these animals at the minimum twice a year, but also the main concern being, because we don't know about cross protection, until there's sort of good evidence that you would get cross protection from the point of view of the asinine herpes viruses, we've elected not to vaccinate on the basis of that.
No more questions?
I've got one more. We've had some discussions about pain in donkeys here over the last few days, and you mentioned the trigeminal infection by herpes virus, which certainly in humans can be very painful. Is there any evidence of that happening in equids? I mean, it would be hard to say, but...
Yeah, the associated with trigeminal ganglia, there's no inflammation within the trigeminal ganglia. There's been work looking at head shaking, horses tossing the head up. I don't know if this syndrome is observed in donkeys and mules, potential association with herpes virus infection, but so far there's no good evidence. But that's true. I mean, we recognize horses with, it's more like a skin condition, more like a hypersensitivity, and then down the road they end developing this leukotricha, this white pattern, either spotted or more reticulated pattern around the back, the withers. I don't know if you guys have ever seen that. Anyways, if you catch these horses in the acute stage, you truly have very painful skin condition, and it is believed that it is associated with herpes virus infection, leading to that hypersensitivity during a short period of time. It's possible the same condition happens in other equids. One last question?
In cats, the feline herpes virus is in the trigeminal ganglion, and they shed and have recrudescence of the virus in clinical signs. Now, have you tested ocular discharges in all this?
The question is, because of the reactivation of trigeminal ganglia, if ocular discharge could be a good surrogate to determine if an animal is shedding. It's not any better than nasal secretion. It's a little bit more cumbersome to collect ocular discharge. In clinically affected animal, the interesting part, clinically affected animal, either neurologically affected animal, horses with rhinopneumonitis, you can find the virus in many other biological samples. One of them is feces. Like all these neurologically affected animals have PCR positive feces. Horses do produce quite some large amount of feces. I'm assuming donkeys and mules do too.
Yeah.
Oh yeah, oh, that's right. Well, thanks for having me.
Great, thank you very much.